Welcome to the Healthy Aging Pod. I'm Kelly Yee. You can follow me on Instagram at Kelly Yee Yoga or subscribe to my YouTube channel at Avatar Yoga. In partnership with EPC Canada, we are excited to bring you our Healthy Aging webcast series. Our guest today is Carol Krucoff. She is a certified yoga therapist and co-director of the Integrative Yoga for Seniors teacher training program offered at Duke Integrative Medicine and the Kripalu Center for Yoga and Health. She is an author and co-author of several books and has contributed to numerous national publications, including the Washington Post, Yoga Journal, and the New York Times. Carol has been practicing yoga for over 40 years and has a passion for movement as medicine with a deep personal commitment to the healing power of physical activity. Hello, Carol. How are you today?
I'm doing great, Kelly. Thank you. How are you?
I'm very well. I want to thank you so much for being here today. And I just want to brief everyone before we start is that Carol is actually one of my teachers, and I'm so happy that she was able to join me and to be my guest to discuss yoga today and yoga for healthy aging, because I have found that taking Carol and Kimberly's program, Yoga for Seniors at Duke Integrative Medicine, has really changed the way that I teach and how I see the health benefits of yoga for people of all ages. So thank you so much, Carol, for being here with me today. And ask you a question with regards to, based on your work, what are the health benefits that you have found of practicing yoga regularly?
Well, the health benefits are vast, and the research is becoming more and more clear about these benefits. We're finding that musculoskeletal changes like chronic pain, back pain, tremendous relief for people from the yoga practice. Arthritis pain, all of this is very much helped by the yoga practice. On the cardiovascular level, there are also many beneficial changes in blood pressure, in heart rate, cholesterol profile. On the mental health level, many positive changes, reductions in anxiety and depression, improvements in mood. So there are just a host of benefits to practicing yoga. And there's even some literature that suggests that people who practice yoga and meditation may actually be able to slow the aging process, which is pretty exciting.
That is very exciting. It's like the fountain of youth.
Well, in some ways it might be.
So true. So I'm glad you touched on the mental and emotional health benefits, because that was also one of the questions that I had, because we know that, and a lot of people tend to practice now, especially in developed nations, because of the physical benefits. Like we kind of feel the physical benefits, and whereas the mental and emotional benefits, I think for those of us that have practiced regularly, we start to feel them and experience them. But for people starting off, not sort of recognizing, and now with research and evidence-based research, they're definitely showing that there's this mental and emotional health benefits for people that do practice yoga. Have you found the social health benefits along with spiritual health benefits, which we didn't really touch on? So can you speak to that a little?
Yes. In yoga, we call the social benefit, the benefit of being in community. The Sanskrit word is sangha. So being in a community of like-minded people in and of itself has strong health benefits. Something that was really coming to light in the literature before the pandemic was the fact that loneliness and isolation are risk factors for disease. So on some level, they're saying that loneliness is the new smoking, that for some people who are lonely and isolated, this can have negative impacts on health, similar to smoking packs of cigarettes a day. That was before the pandemic. So if you look at what's happened in the world as we've all been isolating in our own homes, that isolation may be even stronger. So coming out of the pandemic, the importance of community and of being with people can be profound. And in teaching on Zoom, which is what I've been doing for the last year, teaching yoga on Zoom, I'm finding that it is possible to create community even on the computer. It's challenging, but it's still possible. And I've had my students say that, coming to the yoga class on Zoom once a week is the highlight of their week. And I think that's as much for the experience of the practice as the connection that we make. We're social animals. So connecting with others is a very profound part of the practice. So yoga can impact us on so many levels. On the physical level, certainly we can get stronger and better balance, more flexible, better endurance. On the energetic level, it can improve our energies and our mood. On the mental level, there can be some cognitive benefits from the physical practice. And on a community level, connecting with other people. And then, of course, the innermost layer of all these layers in yoga is the spiritual level. And it truly is, yoga is a spiritual practice. It's about connecting with our deepest, truest self and connecting our sense of being an individual with that something greater. Of course, it's not a religion. There's not a theology. You don't have to believe in any particular God or even believe in a deity at all. That said, it's a very spiritual connection with the big question, who am I and why am I here? I guess that's two questions, but that's what the practice seeks to answer.
Oh, I love that you say that. And that's everything that, I personally experienced in practicing yoga. And that's the same thing in my teachings. I see the same thing and I received the similar comments. So even doing this now via Zoom or via, video conferencing, teaching, the social benefits, I know so many of my clients that are expressing that, they, like, similar to what your comments have been, is that it's like a highlight for them to really sort of connect with the community. And for some people, it is their only connection, because being isolated right now with COVID, they might be in a vulnerable state. And so socially connecting with people is limited. And so being via the computer is actually their kind of soul connection. So I've definitely found that experience. And this kind of coincides as well, a interview that I previously did with a mental health researcher from Simon Fraser University. He also expressed the same comment based on their research that, the importance of like mental well-being and to keep us kind of going, especially during this time, is, physical activity and of course the social connection. And he said, we can still do that via technology. So as I mentioned, I had taken your program, the Yoga for Seniors program at Duke Integrative Medicine. So yourself and Kimberly Carson are the leads for this. And I know that you've also written several books on this subject matter. So let's sort of move into specifically for healthy aging for adults and possibly people living with ailments. Can you maybe address some of the highlights for healthy aging for those people that might be suffering from ailments? And you addressed that sort of briefly as well with cardiovascular and etc. So can you sort of talk to that a little further?
Sure. So yoga can be very helpful for people regardless of what's going on with them. I very often, back when I was teaching in person, would have somebody kind of stick his or her head into the room and kind of say, is this the yoga class? I'd really like to do yoga, but I'm not sure that I can really do the class. And I say, well, there's only one thing you need to be able to do to practice yoga. And they'll say, well, I can't sit cross-legged on the floor. And I'll say, you don't have to be able to do that. Well, I can't stand on my head. You don't have to be able to do that. And of course, I know you're shaking your head, Kelly. You know what the one thing you need to be able to do to practice yoga is, of course. You got to be able to breathe. And then they laugh, oh, I can do that. I can breathe. And if you can breathe, you're in. So very often people feel that when they have different health conditions that they just are not going to be able to practice, which is not true. An appropriate practice is available to anybody who can breathe. I mean, I see folks who are in the middle of cancer treatment, people who've had amputations. I myself have had open heart surgery. I was born with a congenital valvular abnormality. My aortic valve, it was a bicuspid valve. So that meant 2 of the leaflets were fused. So over time it got narrow. So I practiced yoga when I was in the intensive care unit recovering from heart surgery. I mean, it didn't look like the sun salutation. I was just lying there in bed, but I was practicing. I was breathing, I was meditating, I was doing gentle movements. So all of these tools of yoga are available to people regardless of the health issues that they're dealing with. And when people talk about yoga in the West, they tend to think about postures. People say, I'm doing yoga. They think I'm doing a posture, but postures are just one piece of the yoga toolkit. In addition to postures, there's breathing practice, there's meditation, and then there are the principles. So for yoga, it's not just what you do, it's how you do it that matters. So yoga teaches us that we want to move into a posture to the point that we're getting a challenge, but we're not straining or struggling. And for many people who are raised in a Western culture where we're always pushing ourselves and we're always striving and we think we have to look a certain way, this is huge. Learning how to move with this yogic sensibility of finding balance, of doing just enough, not too much. You don't want to be lazy, but you don't want to be pushy. That sensibility of movement can be a huge teaching that they can take off the yoga mat and bring into daily life. So for people regardless of what kind of health challenge they're dealing with, there is an appropriate yoga practice. Sometimes it's tricky to find it because people with different health conditions may not be well advised to just walk into your general yoga class at the gym and jump into whatever people are doing and think that, well, it's yoga, so it's supposed to be healing, so I should do this. That's not how it works. It needs to be an appropriate practice, which is why working with, if somebody truly has a complicated medical issue, they might be best served by at least beginning working one-on-one with a yoga therapist, someone who has extensive training in working with people with different health conditions. Did that answer your question? I feel like it was a long answer.
That was a great answer.
Good.
Yeah. I totally agree. And I had another one of my teachers has, informed me too that he had the opportunity to work in hospitals with, teaching yoga. But like you said, it was essentially it was breath work, right? Like teaching the breath work and very minor movements, but teaching breathing. And it's almost like we take breathing for granted, right? Like it's there's so much involved with breath work and healing, and yet because it just sort of happens naturally, we kind of take it for granted, I think, sometimes. And yoga kind of brings us back to actually being so much more aware of our breath and that self-awareness. And kind of essentially what you were saying is like what we learn on the mat is just an aspect of it. And it's like, how much of this are you able to take off of the mat at the same time? Because the poses, as we know, you mentioned, Western world often stresses a lot of these like standing on the head poses, right? Like it's kind of very, what's going to be the most get the most likes, I guess, is more of what we're kind of looking for sometimes. And the no pain, no gain kind of cultural mentality that we have versus going into a yoga class where it's trying to find that balance where you're challenging yourself but not pushing yourself to the extent of pain or hurt. And then sometimes, and I teach this too, which what I've learned from you is like sometimes we have to draw back and not push ourselves and actually see what happens when we're just flowing, letting things happen naturally and not actually going into that push, because there actually is a lot of gain there from a health standpoint. And like when we talk about yoga being that mental emotional side, if people even took a step back and took a class where it's just easier, a lot of self-awareness, a lot of breathing techniques, it's phenomenal. And I'm one of those people that are very much, I'll push myself to the point of hurting myself. And I've done this so much in the past. So yoga's really brought me to this. So I'm so grateful that you have talked about this because it is a fine balance. How would you recommend to someone that's maybe starting off with yoga, maybe they're older adults, maybe they live with ailments, and seeking out a yoga practice? Like, should they, read something first? And then how could they potentially, what would you recommend here for them to try to find someone that's a little more qualified?
As yoga has become so popular, along with this popularity is a just boom in the number of yoga teacher training programs. When I took my yoga teacher training back in 1999 is when I started, so 20 years ago, there were only a handful of yoga teacher trainings in the country. And I did a teacher training back then because I learned that there was going to be one very close to me. I didn't particularly want to be a yoga teacher, but I thought, wow, there's going to be this wonderful teacher, Esther Myers, who was from Toronto, came down over the course of 2 years to do a 750-hour 2-year training where she'd come for 6 days and we'd do an intensive, then we'd have a lot of homework, and then she'd go back to Canada and then she'd come back. But anyway, that was very rare. It was a very rare thing to have a yoga teacher training. Now there are, you can hardly spit without hitting a yoga teacher. There are teacher trainings everywhere, and the minimum amount, it's just a 200-hour is all people need to become registered with the Yoga Alliance. And that is really just the tip of the iceberg. So I would greatly encourage people who have health challenges and older adults to be very, to look for a really qualified and experienced teacher. What we found when Kimberly and I doing our program, working with physicians and physical therapists at Duke Integrative Medicine, is that many of the commonly taught practices that we do in yoga are actually contraindicated for people with common conditions like osteoporosis, which is very, very common among postmenopausal women, and it's common in men as well. So something like a standing forward bend with straight legs, which is a staple of Most yoga classes, you're going to have that in either standing or sitting. That can increase fracture risk. I mean, I'm a postmenopausal woman who has low bone density. I have taken all of that out of my practice. I don't do sun salutations anymore because I don't want to fracture. Most yoga teachers don't recognize this. So it's becoming more and more known that it's really important to find a qualified teacher. So how do you find a qualified teacher? You ask the teacher what their qualifications are. How long have they been teaching yoga? Are they fresh out of a 200-hour training, or have they been teaching for many years? And what training do they have? Do they have more than that 200 hours? Do they have experience? There's a whole level. The Yoga Alliance has an experienced teacher if they've taught for, I guess it's, I'm not sure of the exact requirements, but you can certainly ask your teacher how long they have practiced, how long they have taught. And then yoga therapy is another profession that's becoming more and more professionalized. It's only within the last, I think it's 5 to 6 years, that the International Association of Yoga Therapists has set the standards for who can call him or herself a yoga therapist. So I'm grandfathered into that program as a yoga therapist. I've been doing the work for more than 2 decades. Is this teacher a yoga therapist? Are they experienced yoga teacher? How long have they been teaching? And even more important than that is how long have they been practicing? Because in my opinion, the best yoga classes come out of a teacher's own practice. So sometimes, you'll find that somebody who teaches a lot maybe doesn't have much of a personal practice. That may not be appropriate. And then there are specialized trainings for working with older adults, like the training that you took, Kelly, with Kimberly and me. We have a website, Yoga for Seniors, yoga, the number 4 seniors.com. And on our website, we list graduates, people who've taken our program. So if you want to find a teacher who studied with us, that's a way that you can find, at least then that teacher has participated in a training program where they learned about how to teach safely and effectively for older adults. Kimberly and I also wrote a book about this, Relax into Yoga for Seniors. So this gives important information about contraindicated movements for different health conditions. I mentioned osteoporosis, which is a big one, because like many disorders of aging, it's a silent disease. People can have low bone density and not know it. And the first symptom could be a fracture. So that's certainly not what anybody wants to experience. Heart disease is a very, very common issue among older adults. More than half of all older adults have hypertension. Something that's commonly taught with breathing practices in yoga classes are extreme breathing practices. So breath holding your breath, or doing these extreme breathing practices can actually be inadvisable if people have hypertension or heart issues. So we talk about this in our book, so that's something you can read about. But a well-trained teacher, someone who has worked with older adults, has extensive training beyond that sort of 200-hour basic, would be a better choice.
Thank you. So you've actually answered a few of my questions, but I have to say I read that book from front to back, so I highly recommend it. I find a lot of the students that I tend to attract now tend to be people that are either living with ailments, and they could be of any age, and older adults, because of the modifications that I'm always offering. And at the same time, they can kind of feel challenged, but not so burdened where they're not fitting into the class at the same time. So yes, you did mention contraindications. So can you talk a little bit about Warrior One?
Warrior One. Actually, Warrior One is a relatively safe pose for most people. Um, Warrior One is, for those who are not familiar with it, it's a standing pose. One leg is forward, the other leg is back, the front knee is bent, the arms in a typical Warrior One might be raised overhead. So for some people, say with shoulder issues, with fussy shoulders, the arms overhead might not be comfortable. So having the hands together in prayer position or arms at the sides could be a modification. For people who have any balance issues, it might be useful to practice Warrior One near a wall, maybe with the back heel pressed into the wall if there's any stability issues, or near a chair or a wall, something to hold on to. But in general, Warrior One is a pretty useful and relatively safe pose for most people who are ambulatory. And just like the name might suggest, it can help people feel very confident and have a sense of power. It's a powerful pose. And being in that gesture can help us feel better. So, it's very interesting. We say that, oh, gee, you're in a slump today. And people are in an emotional slump, but they're also in a physical slump. And which comes first? Are they in a physical slump? So it's very interesting that when we improve our posture and lengthen and create this sense of ease and perhaps even power, then the emotions can follow. So it's Warrior One is a lovely pose. That's really accessible to most people.
Right. And as you mentioned, there's different ways to modify, right? Like you can widen your stance if it's the twisting might be rather than having that 45-degree angle or, having more of that parallel, because you might lose that balance. You can widen your stance, shorten your stance if you need to.
There are infinite ways to modify the pose. As you probably remember from the training that Kimberly and I offer, that we have something we call the continuum of practice, where what we ask teachers to do whenever they're considering a pose like Warrior One is, number one, why are you teaching this pose? Like, what is the intention of this pose? And the intention needs to be clear. So it's not just, well, I teach this because my teacher taught it, or every class has to have it. No, I'm teaching this because I want people to get a sense of empowerment, or I want people to have, strength in their legs. So what are the intentions? Why are you teaching it? And then the next question is, what are the risks? So some of the risks, as you were saying, could be if instability. Somebody might fall if they're not stable, if their legs are too close together. So you notice what the risks are. And then you look at the student in front of you. So if you're not a teacher, if you're thinking of this for yourself, well, what are your issues or limitations? And you take those into consideration. And maybe the issue or limitation is, I broke my leg and I can't stand up right now. I'm in a boot. Okay, can I not do Warrior One? Well, you can absolutely do Warrior One, even in a chair. So, you can sit tall in seated mountain pose. You can extend your arms out or up, and that'll be your Warrior One. And you're sitting in a chair, but it's still Warrior One. So that's our belief, is that any student can do any pose, regardless of limitations. It might just be a piece of it, but that's fine. That's fine.
One of the things that I've taught as well that I learned again from you is the like different versions against a wall, like sun salutation against a wall. And that was one thing that I really love, like being able to do showing people how to do a plank against a wall. And it's not actually that easy. So it's a great strengthening, but you're vertical and it's less difficult because we know that we have students that have a difficult time, coming down onto the mat. So, using a wall is And props, I'm always like recommending as well, because like whether you're using a chair or a wall, it's like there's lots of ways to modify your practice, and it can be just as challenging. Final question that I have for you is, we kind of went over a little bit on, requesting and looking for a proper instructor. But how do you think that we can, as instructors, start to convince the healthcare system to implement more yoga into as part of treatment and prevention programs?
One of the best ambassadors for bringing yoga into the healthcare system are our students who are in the healthcare system. So if you have a student who's a doctor, a nurse, a researcher, an exercise physiologist, when they realize the benefits for themselves, they are more likely to suggest yoga to their patients, to their clients, to the health system. I know that some of the very prominent people in the medical field in the yoga community came there through their own personal issues. So I don't want to call out specific people, but I can think of two off the top of my head who came to the yoga practice because of back pain. And when their back pain that had been bothering them for years and was chronic and was so serious was gone, they both became leading yoga professionals. And one is a physician. So I think the practice is so profound that when people experience it, they want, and the benefits, they really want to share it. And of course, within the medical community, reimbursement is a big issue. So at this time, there are very few insurance programs that I'm aware of that will reimburse for one-on-one yoga therapy or yoga classes. Hopefully that will be coming as prevention becomes more ingrained within the health system. So it's not a disease system where we're just paying, for the disease of the week, but we're actually paying so that people will stay healthy. That would be welcome, but we'll have to see where that goes.
But we'll just keep on pushing, right? Like we'll just keep encouraging.
Do the work. Just do the work, and like the Gita says, you do the work, you let go of the outcome, and it'll happen.
Well, that's a great ending to this. So thank you again, Carol, for all of your wisdom.
Thank you.
I could talk to you for probably several more hours because there's so many more things I'd love to talk to you on, but I know that your time is precious. So thank you again. I hope to see you soon in person. And I would love to, take another program with you at some point in the near future. So thank you so much. You've changed my teaching and my practice, and all for the better. So.
Well, thank you very much. My pleasure to be here.
Thank you.